In order to identify infants and toddlers' current levels of competence, we rely on the observation of skills mastered, which then informs our future planning. For infants or children experiencing difficulties, we should strive towards early identification, diagnosis of specific difficulties, and the introduction of appropriate intervention approaches. None of these can take place without prior observation and assessment of the current situation. Observation and assessment processes can also be used to identify the effectiveness of the setting, specific areas of the setting, specific activities, and the educator. Arguably, to see the children progress and be happy is every practitioner's ultimate aim and one that gives us tremendous satisfaction and reward. We therefore need to be prepared to examine our own practices closely to ensure that we are supporting and not compounding children's learning opportunities. If we aim to provide appropriate play-based experiences for all infants and toddlers within our settings, then we should be prepared to capitalize on the value and practical usefulness of the observational approaches and ensure observation is a regular activity. In special circumstances where a child experiences learning difficulties or special needs, educators must place the difficulty being experienced as secondary, for example, autism, and focus on the assessment of the child. Using autism as an example, an educator should focus on the child's current abilities along with his or her strengths, weaknesses, and likes or dislikes in order to inform future planning. Observation, assessment, and reporting should always be an integral part of every early years establishment when providing children with learning experiences during free play.